Thank you for joining Georgia Transplant Foundation this evening for our talk, Conquering COVID-19, a Lung Transplant Recipient's Experience. I'm Deb Long, the coordinator of the Mentor Project and the Trends in Transplant Conferences at GTF. I want to remind everyone that no one speaking tonight is a physician and that each person must be sure to defer to your own physician and transplant team regarding your treatment and medical health. The presentation tonight is recorded and it will be put on the website once it's ready. Only the presenters will appear on the recording, not the attendees, so please don't worry about that. Georgia Transplant Foundation has other resources available on our website, including upcoming virtual support groups, workshops, and more. I would also encourage you to like and follow us on Facebook. Tonight, we're using Zoom as our platform, and it's imperative that you keep yourself muted for the duration of the presentation. If you have questions, you may type them into the comment section during the presentation, and we'll answer them at the end. I'm honored to introduce Cal Henry, who is the lead mentor of the Lung Group in Georgia. He's done all the work to set this up, and he's going to talk briefly about his own background and his work with the Mentor Project. And he's also going to introduce our main speaker tonight. Thank you so much, Cal, for bringing this important topic to the transplant community.
Hey, thank you, Deb, and thank you, Georgia Transplant Foundation, for providing a platform for us to meet like this this evening. As Deb mentioned, I am the lead lung mentor. I'm closing in on 8 years post double lung transplant. I received my transplant in December of 2012, about 3 days before Christmas. And I've been with the mentor program for almost 6 years now. So originally, when I was placed on the waiting list, I wasn't aware too much about the Georgia Transplant Foundation, but after transplant, knowing what I went through, and as alluded to earlier, there aren't a lot of lung transplant recipients out there. Lung transplants are in the minority for major organ transplants performed annually. So there aren't a whole lot of us around. So I wanted to do my part in helping anyone that was following my path and had gone through what I went through in order to receive a lung transplant. So as organ recipients, COVID-19 is very concerning. Because we are an elevated risk community. Medications we are required to take place us in an immunocompromised status that makes us especially vulnerable to viruses and bacterial infections. So information about how to handle the new coronavirus continues to evolve. And there doesn't seem to be a tremendous amount of information out there for us to look at as organ recipients. So one of the things I did want to point out, especially since originally we were looking at making this presentation available to lung transplant recipients, and now to as many that are affected by transplantation as available. If you are a lung transplant recipient or a transplant recipient through the Emory Hospital Transplant Program, there is information on there which refers to, and I am going to go ahead and display that right now. On the Emory Health Care website for transplant patients specifically, it does direct us to visit the AST website for transplant specific questions where COVID-19 is concerned. And if you follow this link over here for the AST website, it'll take us over to the website for American Society of Transplantation, and there's a description over there and regularly asked questions for where you might find answers. So like a lot of you guys, I try to proactively find as much information related to the new coronavirus as possible. And while doing that, I came across the news excerpts back in March of the very first coronavirus cases or confirmed coronavirus cases in the state of Michigan, and subsequently learned that one of the two cases announced at Michigan Governor Whitmer's press conference was a double lung transplant recipient. And I'm glad that he has agreed to join us and speak to us today. His name is Paul DeWeiss, and he recently received his double lung transplant from the University of Michigan Transplant Program. And he will speak with us about his experience in hospitalization after acquiring COVID-19. So afterwards, we'll have a Q&A session. So during the presentation, there at the bottom of your screen, you can submit questions using the chat function, and we will pose those to Paul after his presentation. So right now, we'll give Paul the floor.
Okay, thank you, Calvin. I'm very honored to be part of the group today. Like I was talking earlier, I really enjoy spreading the word and making people aware of, that there is life after a double lung transplant. There's life after colon surgery and even after COVID-19. It's amazing. So I will just get started with my presentation. I just want to start out a little bit about my lung transplant, talk about my colon and COVID-19. I have a disease called alpha-1 antitrypsin deficiency. Can you see my screens? Oh, you can't see the screen? What happened? Can you hear me? No? Yeah. Oh, uh-oh. No screen.
Share your screen.
Okay.
We can hear you.
Okay. I thought I was in sharing mode, but maybe that went away. Hold on here. I will get it. There we go.
There we go.
Okay, are we good? Okay.
Yeah, we're good, but go to presentation mode.
Okay, I tried and it won't let me do it. I don't know. I had problems with this earlier. Oh, there we go. Okay. Okay, are we good now? You see the full screen? Nice. Okay. Okay, so like I mentioned, I'm just going to give you a little overview of my three situations here. I have a disease called alpha-1 antitrypsin deficiency. That's what caused me to get a double lung transplant. It's basically a form of emphysema. It's a genetic form of emphysema. I got diagnosed when I was 37. That was 20 years ago. And I just had a lung transplant in 2018. So I'm just a little over 2 years out on my transplant. With this disease, your lungs slowly die from the bottom up. Prior to my transplant, my FEV1s, which I think probably most of you know what those are, they were at 15%. I could barely walk and life was really, really hard at the very end. My transplant path, I went to one hospital. They told me I was too healthy to get a transplant. Then I went to U of M, and they went through a year of testing with me, and I got listed in September of 2017. I had a dry run on Christmas Day in 2017. Cal, you probably know what that means. I basically, they called me and told me they had lungs for me on Christmas Day. And I got there after 18 hours, the lungs had pneumonia in them, so I couldn't get the transplant. But luckily, I got a call in February 2018, and I did get new lungs. It was a 6-hour procedure, 2 weeks in the hospital. Everybody thinks when you get a lung transplant that your breathing is automatic and clear right away. Well, it wasn't. You can see the picture of me there. You can't really breathe too well with all that stuff on. But so anyway, but after 48 hours, I was off the ventilator, and within 3 days, they have you up and walking. So I did very well. I was out of the hospital in 13 days, I believe. My recovery, I have 3 college-age daughters, my wife that helped me out. It was a major impact on our family. I had a blocked bronchial tube. It was 90% blocked, which caused another surgery. And then I just had multiple hospital stays with all kinds of different things in the first several months. But then after many doctor visits and, you know, the doctors basically own my life, you know, every day they're calling you, talking to you, making sure your meds are right. Within 2 to 3 months, I was feeling great. I was back to work after 10 months. Everything was good. And then all of a sudden I got some colon issues. I had an infection in my colon. It developed into diverticulitis, which I never had. You know what they say about transplant, you always, you know, you're giving up something, you're giving something up and taking something else on. So that's what happened. I have great lungs now, but it causes other problems. So I got diverticulitis. They had to remove a foot of my colon. I had to be on a colostomy bag for about, I think it was about 2 months. And I was in the hospital for 2 weeks for that one. And believe it or not, that colon stuff hurt way worse than my lung transplant did. So that was another recovery period for me. So I went through a couple pretty big things. And now I'm at 110% of predicted FEV1s for my lungs. I have 29-year-old lungs in my system, which is amazing. I can't even tell you how great it is. I can walk, run, I can do amazing things now. Let's see, I'm on rejection drugs forever. Cal mentioned that. Your lungs can reject at any time for any reason. So my advice to everyone is just do healthy things. Be as healthy as you can. Eat healthy, exercise, and do smart things. So that's that. I'm very, very careful of germs, and I was able to go back to work for my lung transplant, and I fly a lot for my job, so I was always, wearing a mask even when masks weren't in. So about 3 years ago, I started wearing a mask out in public and on airplanes after my transplant, and just because I traveled so much. So, and I do have a very deep emotional connection to my donor, even though I haven't met, my donor's passed away. I haven't met the family yet, but we've been in communication. So it's pretty crazy stuff. And then comes along COVID-19. On the first day that I had COVID, I had a headache and a sore throat, and I just thought, oh gosh, here I go. I'm gonna start having another cold. And the second day I woke up and I still had a headache and a sore throat, but I also had chills, fever, diarrhea, stomach pain, body aches, and then I started vomiting. And one thing about transplant patients is that anytime there's anything majorly out of normal realm, such as vomiting, chills, fever, you're directed to go straight to the hospital, to the emergency room, and get checked out. So that's what I did. I'm a good lung transplant patient. So I got there and they tested me for the flu, and the result came back negative, and I couldn't even believe it. I'm like, what? There's just no way I don't have the flu. I mean, I've had the flu before, and I had every single flu symptom there was. So the nurse says, well, the doctors want me to test you for something called COVID-19. And I was thinking to myself, wow, well, that's been on the news. And there's a lot of people dying in China from that have, weak immune systems. And I have a very weak or, compromised immune system because of my lung transplant. I'm thinking, holy cow, that's the thing they've been talking about on TV. And she said, Dad, don't worry about it. 99.9% chance you don't have it. I'm like, okay, great. So they tested me, and right after they tested me, they put me in isolation. They said the test won't be back for 24 hours. And it was about exactly 24 hours. A doctor came into my room and told me my result was positive. I tested positive for COVID-19. I couldn't even believe it. I mean, my heart sunk. I couldn't talk. I thought that was it. thought life was over because that's all I heard was people were dying in China from it. And since I was the first one to be diagnosed, in Michigan, I didn't know what to do. I was panicked. So it was very emotional on me. I took the news very, very hard because, I had already went through, that's why I gave you a little bit about my story ahead of time. I survived a lung transplant. I survived my colon situation. I survived several hospital stays and now this, and I just thought, this is my end. Here it comes. When I had my lung transplant, the number one thing I wanted to do once I got my lung transplant, or one of my goals in life, was to be able to walk, actually walk my 3 daughters down the aisle when they get married, because they're all in their, mid and 20s area. And that's a huge thing for me to be able to walk them down the aisle. And I thought, oh gosh, here it goes again. I'm not going to be able to do that. And, I was all depressed and it was terrible. I mean, I just couldn't believe it. Had to notify everybody that I was in contact with for the past 14 days. Unfortunately, I went to the dentist the same day that I went to the hospital. I had to call my dentist, who I've been going there for 20 some years, and tell him that, he was just inside my mouth, and so was his hygienist. And, I got the COVID-19, and he was like, what? Oh my God. It was crazy, because at that point it was so new to everybody. And so he said, oh my gosh, I got to go to the hospital right now. And so we got off the phone, he went, but he didn't get a positive diagnosis, which is great. But then, we had to notify everybody, our neighbors, our friends, everybody. And like I said, it's very emotional, because when it was so new, people are just like, oh my gosh, he's got the COVID. It's like I felt like I was the part of the neighborhood. Everyone was probably going to, be avoiding our house forever, and, all those kinds of things. So I was the first lung transplant diagnosed. They did put me in isolation, and I wasn't able to have any visitors. So I wasn't even able to hug my wife, or, tell her I love her, and oh my gosh, here we go. So it was just very sad. And then on top of that, like Cal had mentioned, Governor Whitmer was on the news the very same day that I got the diagnosis, and she was already on TV telling the story about, she at that point, she said there's 2 diagnoses in Michigan. And then I started being known as the male in his 50s that travels domestically, that lives in Livonia, works in Southfield, and is at U of M hospital. It's like within the same day I was diagnosed, that they knew all this stuff. It just blew my mind. Reporters, are crazy. They just figure stuff out somehow, some way. They actually put a picture of the building I work at on the news. That just blew my mind. I couldn't even believe that they put a picture of where I work up there. And they also even said that he lives somewhere in the vicinity of 5 Mile Road and Middle Belt, which is pretty darn accurate. I live about 5 houses from that. So how they get all that information, no idea. But it was just, it was a very emotional time. The first few days, I was shocked and hurting emotionally and mentally, everything. So wondering what my friends are going to think, what my coworkers. Also at work that day, I work for a company. We have about 160 employees, and we have them spread out in 4 different offices, but they sent everybody home, and no one's been back to the office since then. So the day that they sent everybody home, they cleaned out the office and had a company come in and do all their sanitizing and everything. So that was major stuff. I will say that. Very, very emotional. The treatment for me, they immediately started me on major fluids nonstop. They gave me 3 types of intravenous antibiotics all at the same time. They were giving me major pain meds as quick as they could, because it was one of the most painful things I've ever had. Between the lung transplant, the colon surgery, and this, this one was probably number two. I mean, my body was just aching like crazy. I mean, I'm thinking about it right now and I'm cringing because it hurts so bad. And as soon as that pain medicine wore off, the pain will be back like crazy. So I just tried to sleep as much as I could. They did do the hydroxychloroquine, I can't even pronounce it, but they did do that experimental medicine on me. And I don't know if that's what worked or that's what helped, but, I definitely, I think I did that for like 5 days. And I was not put on a vent. Now, my doctor tells me that my lungs are so strong with, I have 29-year-old lungs in me. And since the fact that my FEV1s are so high, my lungs are so good, they think that's why I survived COVID, because I did not, it did not attack my lungs like it does for a lot of people that have a compromised immune system. So I really lucked out there. And the treatment in the hospital, the nurses, I mean, they were just great to me. I mean, they knew how emotionally upset I was. The next day, the two nurses, because they gave me two strict nurses, and they were all in the garb. They had the face masks on. They had a little machine around their waist that blew air into this helmet thing they had on. So their heads were like swelled up with air. It was crazy. And that was the first time they've ever worn those. And the doctors were all in that gear, and they would come in and see me, and they wouldn't get near me. And they told me the rest of the hospital was freaking out because they had a patient that had COVID in there. I mean, it was crazy stuff. But so I went through all the treatments. After 6 days while I was in the hospital, I started feeling a little better. But the symptoms kept coming and going. So all of a sudden, one day, like on the 6th day, I was like, wow, I feel good. I don't think I have any symptoms left. But then day 7, I'd wake up and they'd all be back. And come to find out, this has happened with most COVID-19 patients. They come and go until they're totally gone. And so it was a little weird to have them keep coming back, and then I get back on the pain medicines, and then they go away again. So that happened about 2 or 3 times in a row. That's why I was starting to feel better for 6 days, and I didn't go home till like day 11. But the hospital was very, very good to me. I mean, they took really good care of me, and very, very good precautions. At one point, they moved me because they had me in an intensive care isolated room. I didn't need to be there, but that's where they put me. And then after about 4 or 5 days in, they opened up a whole new wing in the hospital that they knew they were going to start getting COVID patients. So they set up a whole floor in the hospital for that. And they moved me to that floor. But as they moved me, I had a security guard in front of me while I was in the bed while they were pushing me. I had a security guard in front of me, behind me, and one on each side, and 2 nurses. And the nurses were pushing me, and the security guards would go up to any crossing in the hospital. U of M is a huge hospital. They employ about 12,000 people, I think. And so every aisle or hallway we walked by, they would stop people and say, "No, no, don't go, don't go. We got something going on." And they pushed me through like I was a very rare patient. But so after 11 days, I was good enough to go home. They sent me home and told me to be in quarantine for a couple more weeks. I thought everything was great, and life was good. I was going home, and then boom, I get home, and COVID-19 had struck my family members. So 2 of my daughters, my 20-year-old and my 23-year-old, had been diagnosed positive while I was in the hospital, and they didn't tell me about it. So I got home, and 2 of them had the COVID-19. But the good thing is they just had headaches, a really bad cough, and they had the smell and taste thing that you hear people talk about, that they couldn't taste or smell anything, and that was a 2 or 3 week process. It took a long time for them to get that back, but that's all they had. I think because they're so young, they weren't down and out. They weren't no other diarrhea, no body aches, no chills or fevers or anything. And then so they got better and I got better. And then 2 weeks later, my wife was diagnosed, and she had been in bed for a week, and I knew she had it, but she would not take my word and go to the hospital. She was too sick. She just wanted to lay there. And so finally I talked to her doctor and I said, we got to get her to the hospital. She wasn't looking good. She was never getting out of bed. And so we took her in, and sure enough, she was diagnosed with COVID. They just kept her overnight because by that time they had a lot of COVID patients, and they weren't keeping them if you didn't have some kind of, a poor immune system, or you need to be on a vent or something. So they sent her home, and the only thing they sent her home on was Tylenol 3. So she spent a few more days in bed, and then she started getting better. So our whole family was down and out for a little more than a month with the COVID. Obviously, we had no visitors, nothing. Good thing we have great family and friends, because they were leaving us food on our front porch and just being so nice to us with bringing us stuff. But yeah, so for about a month and a half, we were the COVID house, and it was pretty sad. But I am a survivor. I fight hard. I play hard. I want to be, I have a will to live, and I'm going to do whatever I can to make myself be a survivor. So, like I said, after a month or so, we were all COVID free. No idea where I really got it from. I said I do travel domestically a lot. I do fly a lot. I go to a lot of conferences. I'm in sales, and I see a lot of people. I do not shake hands. I haven't shook a hand for about 3 years now, which is very hard to do in the business world, but you just don't do it, And so, I find it very strange that even though it has all those major effects, when it's gone, it's gone. I mean, when COVID is out of your system, it's just like having the flu and you're puking for a week or a night or whatever it is, you're done and you're just back to normal. And that's how it is. I'm 100% back to normal now. I am, you guys are still seeing me, right? Yeah, okay. And I'm back to, I love to mountain bike. I go mountain biking. I'm a golfer. I love to golf. I walk at least 5 miles a day. And I just got the okay yesterday from my pulmonologist that I can actually get on an airplane and fly to California. It may be a little bit of a risk for me, but I'm going, all my brothers and sisters, we're planning to meet there. And, life is short. So I have 5 brothers and sisters, and we're all getting together in California just to be together and hang out. So that's happening in a couple of weeks. So I'm really excited about that. And so my tips for people, they're very simple. Remain very positive. I've always had a positive, even going into my lung transplant. I knew I had a chance that I was going to die on the operating table from my lung transplant. I never even thought once that was going to happen, though. I just knew I was going to be a survivor. And so I keep very positive on everything I do. And my wife says sometimes I'm way too positive, and I think I can do way more than I can. But the thing is, I can do a lot now, and I'm just making up for lost time, because for about 20 years, I could hardly do anything. My wife did everything in the house for us, and mowed the lawn, cleaned the pool, all that stuff. But now I'm making up for lost time. But so that's kind of my COVID story and my lung story. I would love to take questions, or whatever you like, Cal.
Great, thank you, Paul. Yeah, we do have some questions for you.
Okay,
I appreciate the story. That's that's the first, or sorry, second firsthand, and definitely the first from a lung transplant perspective, account of actually, someone that's actually gone through and experienced the COVID virus. But some questions. What was the worst thing for you regarding the illness? What was the absolute worst thing?
Oh boy, let me think. It's got to be the pain. I mean, the pain and the part thinking I was seriously going to die, because like I said, it was so new. And it was just hard to imagine what was going to happen, because there was no cases ahead of me, at least in Michigan, or that I even knew of, to know what was going to come out of this thing, So I think that's it. I mean, both of those things were terrible, the pain and just emotionally, it was rough.
Okay. And there was, I believe, someone asked, what's the timeline? What was the date you got sick?
Oh, okay.
What was
Yeah.
the date you were hospitalized?
Okay. So I know these dates pretty well. March 9th, I came down with the symptoms. And then the next day, March 10th, is when I actually went to the hospital and got admitted. And then I was in the hospital until March 21st when I was released. So it all started March 9th and went through March 21st. And like I said, that was, that was already 3 months ago, So a lot's happened since I've had it. And there's pros and cons to being first, because, being first, I mean, the pros are you get one-on-one attention. Everyone in the hospital is like, oh my gosh, we got a COVID person. What are we going to do? And, so, I mean, it was a very, very good thing that they all, they took great care of me. But the cons were, so I was the first person, I was really surprised that they did not know much about COVID. Here they were prepping and getting rooms ready, but even the doctors, I would tell them something was going on. They're like, wow, we don't know. We'll check that. We'll see if that's a symptom, or, I mean, it was kind of crazy. I was kind of surprised that they just didn't know more about COVID, and then I guess what other cons did I have? Basically, yeah, you're just kind of a guinea pig, and that's what they told me. They're like, well, we're going to use you in a good way to figure this out, because you are both a transplant and a COVID. And so you are our first guinea pig. We're taking great notes, and we know we're going to have more. So, that's kind of that.
A question that was submitted did you take, or did you have to take any precautions when having, you came back home and both of your daughters had contracted COVID, and then your wife subsequently? Were there any precautions you had to take at that time because of that?
That's a great question, because what do? You come home, and I have a small house. I mean, we have a 1,600 square foot house. So, you can imagine 3 bedrooms and, 4 of us. So we did try to stay separated for a while. And it just didn't work that well. But then after we talked to the doctors, they said there's no reason to stay separated, because, they have COVID, you had it, and your wife is either going to have it or not have it. And, that's just the way it is. So they told us they told us to try to avoid my wife. At that point, when we contacted the doctors, my wife was already sick in bed. So I was better, and I was making her food, and I was helping her out. So we were secluded just for a couple of days. We tried to stay out of each other's rooms, and, and we were wiping everything down. At that point, there was still sanitizer, and there was still bleach, and there was still, the Clorox wipes. And so everything was being wiped down in the house like crazy. And so, yeah, we did have to separate a little bit.
All righty. Great question. Have you been tested for antibodies?
That's another great question. My doctors want me to be. As of about a week and a half ago, U of M wasn't even testing for antibodies yet. They want to test me, and they're keeping a very close eye on me. They're doing, blood checks, and, and keeping very in touch with me, but I have not been yet, no. And I keep asking my doctors, even my lung doctors, my lung surgeon, none of them know, even if I had the antibodies, does that mean I'm immune or not? They still, as you're seeing on the news, nobody still knows, they really don't. But my doctor, my pulmonologist feels that, that I can be out in society with precautions. So, wearing rubber gloves and wearing a mask, I'm good to go that way. But of course, I'm not hugging people and shaking hands or, touching people or anything. But, I am able to get out and, I do our grocery shopping and stuff like that. So, a lot of lung transplant people I know are, way more strict than me. My doctor once told me, he's like, Paul, we gave you this lung transplant so you can live your life. So I'm doing that. I'm living my life. I'm very cautious, but at the same time, I'm not going to sit home and, whittle my days away by just sitting at home. I like to get out and about and stuff. So that's that. So yeah, I'll be interested to get tested for the antibodies soon.
And it seems like you answered another question at the same time. There was a participant that asked if your doctors indicated whether you are now immune or whether you could be reinfected. And, from your, specifically to you, but as you alluded, no one really knows.
Yeah.
Right now, it seems like, right?
Yeah, nobody knows. And, it's one of those things. And, now, I don't know. I just heard one state that is having another spike now, but it's just so hard to tell about this thing. I'm glad it's going down. In Michigan, our curve is flattened way down, which is great. But now, as of 2 days ago, everything's open, and we'll see what happens. But again, I'm still very safe, and people, especially people with transplants and people with compromised systems, you got to take it easy and you got to be careful for sure.
Great. Another question that was submitted is, did your state's health department work with you on any type of contact tracing information?
Oh yeah, that's a great question. They did, but they screwed things up. I mean, I talked to, so as soon as I got diagnosed, the health department called me, they called my wife and my daughters and talked to all of them, and, where have you been? What have you done? They took all these great notes and everything, but they didn't even contact half of the people or half the stuff. They said, don't worry about it. We're going to contact everyone. So, they did not contact my dentist. I had to contact my dentist, and that was a huge one. And when I called the health department back, they said, oh, we thought you said you'd been to him a week ago. I mean, so they didn't do a great job, especially for being the first person in Michigan to be diagnosed. I was amazed. But yes, they did attempt to do that.
Hey, another question that was submitted from a participant is, what type of anti-rejection medication are you currently on, or were you on? Has that changed any? And that's an addition from me, but
Okay.
I know there's discussions across the board about therapy modulations and whether you back off or remain constant. But for you personally, what type of anti-rejection medication, and did that change any?
Yep, I am on the Tacro, and that hasn't changed. They mess with my dosage here and there. I don't know the full name, Tacrolimus or something like that. Are you aware of it? I mean, I'm sure you are, Tacro. So I'm on
Yes.
Tacro, and what's the other one? I was on a different one, and they did switch it right around the COVID time to mycophenolate, something like that. So they did switch me. And I'll tell you one thing about one of the reason they switched me is because, with these anti-rejection medicines, they take your system down so low that I started getting all these like warts all over my face. And I guess people with normal immune systems, everybody has that kind of stuff, but your immune system just fights it off. And so whatever was going on with my medications, they were coming up all over the place. I was having to go to the dermatologist like once a week or twice a week to get these things, burned off, or, and so they changed my one anti-rejection medicine to that I just call it myco, but it's, they changed me to that one, and that seems to be working much better, at least for that part of it. Thank you. That's it, mycophenolate. Yes, yes, that's the one I'm on, and that seems to work a lot better for me. Does that make sense, Cal? What's that?
I'm so,
Tacrolimus.
Yes, tacrolimus, yes. So you must be a lung transplant patient too.
Nope, kidney.
Oh, kidney, okay, oh, yeah, okay. Yeah.
yeah, one of the things about lung transplant medication protocol is that it was all based on kidney transplant medication protocol. So a lot of organ recipients, different organ recipients take similar medications.
Yeah.
A participant asked, how often are you asked to change out your gloves? I'm not.
Yeah, as often as you would like, and you know, if you go, you know, if you go to one store, you know, you should change them. You know, if you're going to Kroger and then to Costco or something like that, you should change them. I'm not. With my mask, I don't do that, but you know, with the gloves, just they say because you don't want to you know, touch your face with that stuff. You know, that's the problem with going anywhere and wearing gloves, as long as you're not touching your face, because it's the same thing as touching your face without gloves, you know. I mean, so, you know, just as often as you're out there touching things, you know, that's.
I think for this call right now, we have a smaller audience. So if there is anyone on the call right now that wants to ask a subsequent question, you can do so at this time.
Yeah, please do. If you have any question about anything I said, what that would be great.
If you do, you can unmute yourself temporarily and ask the question.
Steve, I have a question. I've read in the AST journal, I think it was, that one of the bad things about the COVID virus is that it tricks the immune system and it over-attacks itself, the lungs in particular. So it fakes out the immune system to over-attack. And there's been some discussion in the transplant community that it's actually a benefit to have your immune system lowered through immunosuppressants, because that reduces that particular aspect of COVID when it reduces it from attacking your lungs or tricking your immune system to attack your lungs. Did you hear about that or discuss that with
Yes, I did hear about that. And, you know, I didn't hear about it from my doctors, but I too belong to the U of M lung transplant support group. We have about 30 people in our group, and that was brought up at our last meeting. We're now doing meetings similar to what you all are doing, and that was brought up. But we didn't have any doctor on the call to kind of explain it. But several people said that it's actually a bonus, you know, or you know, something decent for the COVID. So I have heard that, but as far as from a doctor's point of view, Steve, I don't know.
Yeah, I believe the AST position is that they haven't come to a conclusion on that. It's just
unfortunately, they haven't come to a conclusion on a lot of this stuff, and that's what, you know. Yeah, it's just, you know, my wife is a little scared because I'm you know, a little active, and I like to just go, and she's like, you know, but I take precautions and stuff, but yeah, they're just not sure on anything, or they don't want to come out and say they're sure, you know, so I don't know. I'd like to donate life shirt.
So Paul, you did have a lot of initial symptoms, but what was the first indicator? Was it temperature? Was it the pain, or what was it?
Well, you know, so I had a sore throat and headache, no big deal. I just thought, okay, I'm going to get a cold or something, you know, and, you know, that's a normal thing. And then the next day I just thought, man, I just feel weird. And I think I actually told my wife, I don't feel that good. I think I should probably take a nap. And so I did. I laid down, which I don't take naps either. So I'm just like, well, I just don't feel that good. But sometimes lung transplant people, you know, sometimes, or any transplant people, you know, you just maybe have a bad day or something. So I was thinking, but then as the day went on, you know, they all came at once. You know, it was like, I'm like, okay, now my stomach hurts. Now I feel chills. And I can remember those things so well because when my lungs were down to 15% and I got a cold or something, it would automatically go right into pneumonia or something. And that's like, to me, those are pneumonia signs. And when I started getting all those, I started freaking out. And then the last straw was my stomach just started gurgling and I vomited. I'm like, okay, that, I've got the flu. I got to go in. But little did I know it wasn't just the flu.
All right. Any more questions from anyone? All right. Well, again, thank you, Paul. Oh, go ahead.
Did you have sharp stomach pains?
Yes.
Gurgling to your stomach?
Yeah, it was, my stomach just started hurting really bad. And at that point, I didn't know either if that was like a diverticulitis thing or my colon was starting to act up. I mean, who knows, because like I said, you trade off things when, lung transplant makes your lungs better, but it does other things to your body. So I thought something else was going wrong or something, but after I vomited, I knew that was the flu. It's kind of hard to disguise. Okay, well, great. Well,
Good. So yeah, definitely, thank you for giving up some of your time to talk to us and share your experience with coronavirus. I hope that for everyone here and that will be watching subsequently, that this, being able to hear about your experience and see someone successfully, overcome coronavirus will be uplifting and kind of help alleviate some of the uneasiness that some of us have had.